Hey there. Hello, and welcome to Tuesdays with Tina. Coming to you live on Tuesday, October 1st. Happy National Dental Hygiene Month. Yes, this is day one of National Dental Hygiene Month. Love it, love it. So excited for it to be here. So welcome and thank you for being in today. Hello, Instagram. See you there. Hello, YouTube. See you over there. I'm just going to rotate a couple things here a little bit. So as I said, happy National Dental Hygiene Month. And today I wanted to do just a small little shift talking about our local anesthetics and our patients who have diabetes, right? There's a lot of complications with that aspect, right? We all know that where you're going through and you're reviewing your patient's health history and you see that they have a long list of medications to treat their diabetes and also have it listed. When we're thinking about this, especially in the world of local anesthesia, there's a couple of things we want to be mindful about. And one of those is knowing what our patient's A1C level is. Now, I want to see some thumbs up. If you're watching this back, put in the comments. I'm curious, how many of you on a regular basis ask what your patient's A1C level currently is and when the last time it was tested? Just curious, because I ask my patients this on a regular basis, and you learn pretty darn quick, right? We learn pretty quick who knows for sure and when it was, or they're like, yeah, it was 6.3. They're like, pull out a number that they think is probably right because they don't remember what it was. They don't keep track of it maybe as well, because we are human, right? Our patients are human, and all of us have different items that we really are concerned about. And for some, their A1C levels may not be of concern for them. Yes, I love it. Thank you. I love it. Check out the med history every time when reviewing it. Perfect. I love it. Well, something that we need to be aware of when our patients have, tell us our A1C levels is it actually impacts their ASA status. Okay. And if you didn't know, this flip chart is available. Boop, boop. And in this, I have all the information about A1C status and how it impacts their patient's ASA status. So if we're to see a patient that has an A1C of 8.5 to like 10, that can impact their ASA status to putting them at a higher risk for having a medical emergency, a higher risk for having hypoglycemia because their blood sugars are so out of control. And if we are performing a procedure where we are administering local anesthetics, we might need to have a conversation with them about what their meal plan is prior to coming in and their medication plan prior to coming in, and also with how long they're going to be numb and how are they going to maintain their nutrition and their medication plan after coming in, if that's an issue for them, right? So we want to identify that, because when we start looking at, maybe if you ever have a patient that's in your chair that is a 10.5 on their A1C, sorry, I don't know, my internet is being weird. Okay, right, a 10.5 on the A1C. It's pretty darn high, right? Or you're like, oh, Cracker Jacks. Well, that puts them at an ASA category 3 level. So there's some modifications that we need to make, right? We have modifications that we have to go through and identify, and which could be making changes with our anesthetics. Maybe we want to use less vasoconstrictor. We may want to think about when we time them into our schedule of our day. So just some things to be considerate of with our patients, and thinking about how controlled or uncontrolled their diabetes is when we are doing procedures where we have anesthetics, because it can impact the rest of their day with their medications and their eating habits. So I just wanted to share that with you guys. And again, it is in this flip chart, which is so cool. I'm really excited to be able to share this with you guys on October 1 of 2024, day one of National Dental Hygiene Month. And seriously, you guys, I'm so proud of this. There's so many fun things in here, not just the A1C guide that's in here, but a blood pressure guide as well. And even like a little guide on non-injectables, their names, their durations, how you use them, what procedures you might use them in. So like if you're a student even, or if you're an assistant and you're like, what in the world? Like, if you can't remember the names and the color of the anesthetic, it's all right there. The dosaging, all right there, ready to go. I'm super proud of it. And this is just a sneak peek of the actual book. So this is just the resource flip chart, which is like the appendix of my book, which will be coming out by the end of the year. But I just wanted to share that resource flip chart with you. But there are things to be considerate of. And we can't always remember these right off the top of our head, right? Where you have to go, crackers, what was that number? I need to go back and look at this, at the guide. What does the guide say? What is the blood pressure numbers? Where are we at when we want to know when to modify the patient's ASA status? So like here, let me just give you a random example. Let's see. Ooh, who can figure this out? Okay. Oh, I kind of want to have fun. You guys want to have some fun? Let's have some fun. I'm riffing right now. I have no idea what I'm doing, but if you're on here live, so I've got a few of you over here on Instagram that are live, YouTube, not so much. I need to get more YouTube followers. I only have one person watching live. So I'm going to do a pop quiz, and whoever can be the first person to message me. How do we want to do this? I have more people on Instagram. Sorry, YouTube. I'm going to have to do it this way. Okay, on Instagram. So whoever is the first person on Instagram to tell me the person's ASA status of this blood pressure, I will give you a link so you can just message me and you'll get the digital version only, the digital download only of this guide. I will send it to you. Okay, so are you ready? You in? Thumbs up if you're in. Whoever is the first person to guess the correct ASA status for the blood pressure of this fictional patient is going to get, the first person will get a digital copy of this guide. Digital only, you can't print it, digital only, but you can get it. Good, awesome, all righty. So you have a patient in your chair, they're with you, they're excited to be with you today, and because you are an amazing clinician and you assess your patient's blood pressure every visit, even when you're not performing local anesthesia, and you're using a brachial cuff because you know it's more accurate, and your patient's blood pressure reading is 136 over 91. What is the patient's ASA status? 136 over 91. So the systolic is 136, the diastolic is 91. What's the patient's ASA status? On your mark, get set, go. Oh, see. So Cohook says 3. Oh, winner, chicken dinner. Okay, Cohook, C-O Hook. Oh, so awesome. I love it. Okay, Cohook, message me in Instagram. Send me your deets and I will get that to you. That is right. So a patient with a blood pressure of 136 over 91 would be an ASA status of 3, right? That's an ASA status of 3 because that diastolic, that down number, the bottom number is 90 or above. So that automatically puts them at an ASA 3 status. Love it. So proud. Way to go. I have such smart people on here. You guys are amazing. All right. So if you were like, I need to know this information, let me know. Send me a message if you would like to know more about how to get the guide. Literally, you guys, I am so new at doing this, selling something like this. You know, I have my online courses that I give that you can sign up for and have year-long access to those online courses. You know, and I go to Georgia and I certify hygienists. I certify hygienists in the state of Oregon. I teach hygiene students. I go around and I speak at different conferences. I know those things, but doing something like this and trying to sell it, I don't know what to do. So I need you guys' help. So send me a message if you want to know how you can get a hard copy or the digital download only. That is digital download only, can't print it. Let me know and send me a message and I'll get that to you. I'll figure out how to get it all into all of my website, LinkedIn's and all that kind of stuff. So thank you, friends. Happy Dental Hygiene Month. And thank you for playing along with me and having a blast. And if you've missed any of my previous Tuesdays with Tina, you can always go to YouTube, Teacher Tina RDH on YouTube, and look those up. Have some awesome ones where I've chatted with a hygienist that has done Botox and learned about her journey, talk a little bit about different injection techniques and some other medical emergency options that we have to review in the dental office. So happy Dental Hygiene Month, friends, and I will see you guys on the flip side. Oh, where'd my puppy go? She was right here. I was going to show you my puppy. You'll see her. Oh, you'll get more. Until next week, friends. Cheers. Bye.